There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
Blood pressure is a measurement of the force against the walls of your arteries as your heart pumps blood through your body. Hypertension is another term used to describe high blood pressure. Blood pressure readings are given as two numbers. The top number is called the systolic blood pressure. The bottom number is called the diastolic blood pressure. For example, 120/80, written as 120/80ths of a millimeter. Hg. One or both of these numbers can be too high. Normal blood pressure is when your blood pressure is lower than 120/80ths of a millimeter. Hg most of the time. High blood pressure, hypertension, is when your blood pressure is 140/90ths of a millimeter. Hg or above most of the time. If your blood pressure numbers are 120/80 or higher, but below 140/90, it is called pre-hypertension. Most of the time, there are no symptoms. For most patients, high blood pressure is found when they visit their healthcare provider or have it checked elsewhere. Because there are no symptoms, people can develop heart disease and kidney problems without knowing they have high blood pressure. Malignant hypertension is a dangerous form of very high blood pressure. Symptoms include severe headache, nausea or vomiting, confusion, vision changes, nosebleeds. You can do many things to help control your blood pressure at home, including eat a heart-healthy diet, including potassium and fiber. Drink plenty of water. Exercise regularly for at least 30 minutes of aerobic exercise a day. If you smoke, quit. Limit how much alcohol you drink to 1 drink a day for women, and 2 a day for men. Limit the amount of sodium, salt, you eat. Aim for less than 1,500 milligrams per day. Reduce stress. Try to avoid things that cause you stress, and try meditation or yoga to de-stress. Stay at a healthy body weight. One of the most dangerous aspects of hypertension is that you may not know that you have it. In fact, nearly 1/3 of people who have high blood pressure don't know it. The only way to know if your blood pressure is high is through regular checkups. This is especially important if you have a close relative who has high blood pressure. If your blood pressure is extremely high, there may be certain symptoms to look out for, including severe headache, fatigue or confusion, vision problems, chest pain, difficulty breathing, irregular heartbeat, blood in the urine, pounding in your chest, neck, or ears. Unfortunately, if you wait for the symptoms to manifest themselves, you are too late. The symptom, easily measured, that is of consequence and is diagnostic, is the blood pressure. It should be tested, at rest, with a sphygmomanometer on several different occasions. Generally when it exceeds 140 mm Hg/80 mm Hg, it is elevated and should be treated. There are many different therapies, and the right one for you can only be determined by your healthcare provider. If money is an issue, please record several blood pressure measurements over different days taken at different times of the day to take with you to the appointment. Then follow precisely the instructions and take the medication prescribed. Please, do not delay. Some of the adverse effects, though easily prevented, are not possible to reverse, get seen,